All right, Adpie. ADPIE. That stands for Assessment, Diagnosis, Planning, Intervention, and Evaluation. So when you get a test question and they ask you what you're going to do next, the first thing you need to figure out is where are you on Adpie? By the way, most of your questions are going to be based on either Adpie, Maslow's hierarchy of needs, or your ABCs. But let's say it's based on Adpie. You're going to ask yourself, where are we? So go back to the question. If they've given you enough information that you've assessed your patient, right? Assessment, that's the A part. Then you move on to your nursing diagnosis. And usually that's not an answer choice, but look at your answer choices. If that's not there, then you move on to your P, which is planning. You plan what you're going to do for your patient. And usually that's not a choice either, but look at those choices. And if it's not there, then you move to the I, which is your intervention, actually doing something for your patient. This is where you guys make a mistake. You always want to act before you assess. Well, how do you know what you're going to do for your patient if you haven't gathered enough information, right? And sometimes you'll get a test question where in the question you did something. So what do you do next? Assessment, diagnosis, planning, intervention, and that E stands for evaluation. You have to evaluate what you did. Was it effective? Because if it wasn't, guess what? You're back to A again, assessment.